The human genome is so vast, and the amount of data that there is to interpret and understand and make sense of, it's like, compare it to just like, endless like space. I'm Rana Mckay at the University of California, San Diego. I'm a medical oncologist. My main area of interest is in clinical trial design for patients with metastatic disease, trying to understand who would respond to therapy and who doesn't respond to therapy, and what are the biomarkers that can predict for somebody to respond to a certain type of treatment. Prostate cancer is a very heterogeneous disease from the get-go. There are some people who have very indolent, low-risk prostate cancer, and they never even need treatment because the likelihood that that prostate cancer is going to impact their survival is so low. And then with regards to curative treatments, for those with localized cancer, a lot of patients are cured with surgery or radiation or the combination of surgery, radiation, and hormonal therapy. The goal is actually to try to prolong their life, prevent them from having complications related to their disease, through better refined therapies. The Prostate Cancer Foundation has funded multiple clinical trials and studies of therapeutic agents that have ultimately ended up back in the clinic to help improve outcomes for patients. Drugs like enzalutamide, abiraterone, PARP inhibitors, immunotherapy. These drugs are making their way into clinic really because of the work that the Prostate Cancer Foundation has done. They really create a community within our field, and also try to bring in people from outside the field that aren't prostate cancer researchers, whether they do breast cancer or whether they're epidemiologists or ecologists, bring in those people into the field so we can better understand prostate cancer itself. So they've really been a catalyst for fueling research in this space. Donations coming into the Prostate Cancer Foundation directly fuel team science. They are geared at providing funding for young investigators like myself to help launch their career, and also have the opportunity to provide funding for challenge awards that are conducted between collaborators across multiple institutions to really help move the field forward.